If you have recently been told that you have grade 2 or grade 3 fatty liver, I want you to hear one message before anything else. Do not panic, but at the same time, do not ignore it. Many people over the age of 60 leave the clinic feeling frightened after reading their ultrasound report. They immediately think their liver has been permanently damaged or that liver failure is only a matter of time. Others make the opposite mistake. Because they do not feel pain or obvious symptoms, they assume there is nothing to worry about. Both reactions can be dangerous. Stay with me until the end of this video because I am going to explain what grade 2 and grade 3 fatty liver really mean, whether your liver can recover, the biggest mistakes that quietly make the condition worse, and the practical steps that can help protect your liver naturally. The most important advice comes later in this video, and I do not want you to miss it. I am Dr. Rajesh Kumar, and I have cared for many older adults living with fatty liver disease. One thing I have learned is that fear often comes from misunderstanding. Once you understand what is happening inside your body, you can make better decisions with confidence instead of anxiety. Let us begin by clearing up one of the biggest misconceptions. The grades on your ultrasound describe how much fat has accumulated inside your liver cells. Grade 1 means a mild amount of fat, grade 2 means a moderate amount, grade 3 means a larger amount of fat is present. However, these grades do not automatically tell us how much permanent damage has already occurred. This is where many people become confused. They see the words grade 3 and immediately believe their liver is beyond repair. That is not necessarily true. A fatty liver and a scarred liver are not the same thing. Your liver may contain excess fat without having advanced scarring. That difference is extremely important because it means there is still an opportunity to improve your liver health if you act early. Your liver is one of the few organs in the human body with an impressive ability to repair itself. Every day, it works quietly to process nutrients, remove waste products, support digestion, regulate blood sugar, and perform hundreds of other essential functions. Even after years of unhealthy eating, physical inactivity, or poorly controlled diabetes, the liver still has the ability to recover when the causes of damage are removed. The real danger appears when fatty liver is ignored for years. Excess fat can gradually trigger ongoing inflammation. Over time, that inflammation may lead to fibrosis, which means scar tissue begins replacing healthy liver tissue. If this process continues unchecked, it can eventually develop into cirrhosis, where extensive scarring permanently affects how the liver works. At that stage, treatment becomes far more difficult and some of the damage cannot be reversed. The encouraging news is that many people never reach that stage. With the right lifestyle changes, regular medical follow-up, and good control of conditions such as diabetes, high cholesterol, and high blood pressure, many older adults are able to significantly reduce liver fat and improve their overall liver health. So if your report says grade 2 or even grade 3 fatty liver, take it as an early warning, not as a final sentence. This is your opportunity to make changes while your liver is still working hard for you. In the next part, I will answer the question every patient asks me. Can grade 2 and grade 3 fatty liver actually be reversed? The answer may surprise you, and it could completely change the way you think about your diagnosis. Now let us answer the question that is probably on your mind right now. Can grade 2 or grade 3 fatty liver actually be reversed? My answer is simple. In many cases, yes. But it depends on one very important factor: how early you begin making the right changes. Your liver has an extraordinary ability to heal, but it cannot repair itself if the conditions that cause the damage continue every single day. This is why I always tell my patients not to focus only on the grade written on the ultrasound report. Instead, focus on what you do after receiving that report. Your daily choices will often have a greater impact on your future liver health than the number itself. If you have grade 2 fatty liver, there is usually an excellent opportunity to reduce the amount of fat stored inside the liver. Even many people with grade 3 fatty liver can achieve significant improvement when they follow a consistent treatment plan and address the underlying causes. The key is not looking for a quick solution. The key is making steady changes that your body can maintain for the long term. One of the most effective steps is gradual weight loss if you are overweight. Research has shown that losing around 10% of your body weight can lead to a meaningful reduction in liver fat and improve liver function in many people. You do not have to lose all that weight in a few weeks. Slow, steady progress is both safer and more sustainable, especially after the age of 60. If you have diabetes or pre-diabetes, controlling your blood sugar is equally important. High blood sugar encourages the liver to convert excess glucose into fat. When this continues for months or years, more fat accumulates inside the liver, making it much harder for the organ to recover. Better blood sugar control helps remove one of the main drivers of fatty liver disease. The same is true for high cholesterol and high blood pressure. These conditions often occur together as part of metabolic syndrome, and together they place additional stress on the liver. Improving them does not just protect your heart. It also creates a healthier environment for your liver to recover. Alcohol deserves special attention. If you already have fatty liver disease, continuing to drink alcohol can place even more strain on liver cells. Giving your liver a chance to recover means avoiding alcohol and allowing the healing process to begin without adding further injury. Regular physical activity is another powerful tool. You do not have to become an athlete. Even a brisk walk for 30 minutes on most days of the week can improve insulin sensitivity, support weight management, and gradually reduce liver fat. Small daily habits often produce greater long-term results than short bursts of intense exercise. If you have learned something useful so far, I would love to hear from you. Please type the number 1 in the comments below. It lets me know you are committed to taking better care of your liver, and it may also encourage someone else to begin their own journey toward better health. There is one more point I want you to remember. Recovery does not happen overnight. Fatty liver usually develops slowly over many years, so improvement also takes time. Some people become discouraged because they expect dramatic changes within a few weeks. Instead, focus on building healthy habits that you can continue month after month. Your liver responds to consistency far better than to temporary diets or short-term efforts. In the next part, I'm going to share the 5 biggest mistakes that quietly prevent fatty liver from improving. These are mistakes I see again and again in my clinical practice, and avoiding them could make a greater difference than you might expect. Now that we have discussed the mistakes that keep fatty liver from improving, let us focus on something far more important: what you should start doing from today. Over the years, I have treated many older adults with fatty liver disease. And although every patient is different, there are 5 recommendations that I give almost everyone. These are not quick fixes or miracle cures. They are practical habits supported by medical evidence, and together they can make a remarkable difference to your liver health. The first recommendation is to achieve gradual and sustainable weight loss if you are overweight. This is one of the most effective ways to reduce excess fat in the liver. You do not need extreme diets or long periods of fasting. In fact, those approaches are often difficult to maintain, especially after the age of 60. Instead, aim for slow and steady progress. Even a modest reduction in body weight can decrease the amount of fat stored in the liver and reduce ongoing inflammation. Think of every kilogram you lose as reducing the workload your liver has been carrying for years. The second recommendation is to eat enough high-quality protein every day. Many older adults focus only on reducing carbohydrates, but they forget that protein is equally important. Protein helps preserve muscle mass, supports metabolism, and keeps you feeling full for longer, making healthy eating easier to maintain. If you eat non-vegetarian foods, choose skinless chicken, grilled or baked fish, eggs, and other lean sources of protein. If you prefer a vegetarian diet, include foods such as lentils, chickpeas, beans, tofu, paneer in moderation, and unsweetened curd or yogurt. A balanced meal with adequate protein is far more beneficial than simply eating less food. The third recommendation is to reduce added sugar and highly processed foods as much as possible. Many people think they are avoiding sugar because they rarely eat sweets. However, sugar is often hidden in soft drinks, packaged fruit juices, sweetened breakfast cereals, biscuits, desserts, flavored yogurt, sauces, and many processed snacks. These foods provide large amounts of calories without supplying lasting nutrition. Over time, excess sugar encourages the liver to convert more of it into fat. Replacing sugary drinks with water, plain buttermilk, or unsweetened beverages is one of the simplest changes you can make. The fourth recommendation is to move your body every single day. Your liver benefits when your muscles become more active. Brisk walking for about 30 minutes on most days of the week is an excellent place to begin. If your joints allow, adding strength training 2 or 3 times a week can provide even greater benefits. Stronger muscles use glucose more efficiently, improve insulin sensitivity, and reduce the amount of fat that builds up inside the liver. Remember, you do not have to exercise perfectly. What matters most is consistency. A daily walk is always better than waiting for the perfect day to begin. If these recommendations are making sense to you, type "liver" in the comments below. I always enjoy reading your comments, and your message may encourage someone else over the age of 60 to start taking better care of their health today. The fifth recommendation is one that many people overlook: getting enough quality sleep. Poor sleep affects much more than your energy levels. It can increase insulin resistance, make weight loss more difficult, increase cravings for unhealthy foods, and place additional stress on your metabolism. Aim for around 7 hours of restful sleep each night whenever possible. Establish a regular bedtime, avoid heavy meals late in the evening, and reduce screen time before going to bed. Small improvements in sleep can support the healthy habits you're already building during the day. I also remind my patients that there is no single food, drink, or supplement that can replace these 5 foundations. Your liver responds to the combined effect of healthy choices made consistently over time. Every nutritious meal, every walk, every good night's sleep, and every kilogram of healthy weight you lose sends your liver the same message. It is finally getting the opportunity to heal. In the next part, we will discuss another important question that many patients ask me. If lifestyle changes are so important, does someone with grade 2 or grade 3 fatty liver still need medication? The answer depends on several important factors, and understanding them can help you make informed decisions with your doctor. After hearing about healthy eating, regular exercise, better sleep, and gradual weight loss, many people ask me the same question: "Doctor, do I still need medication if I have grade 2 or grade 3 fatty liver?" The answer is not the same for everyone. One of the biggest misconceptions is that every person diagnosed with fatty liver needs a tablet to make the fat disappear. In reality, that is not how fatty liver disease is treated. For many people, especially in the earlier stages, lifestyle changes remain the most effective treatment. No medicine can replace healthy daily habits. However, that does not mean medication is never needed. There are situations where your doctor may recommend medicines as part of your treatment plan. The decision depends on your overall health, not just the ultrasound report. For example, if your blood tests show persistently elevated liver enzymes, it may suggest that your liver is under ongoing stress or inflammation. If you have type 2 diabetes, your doctor may prescribe medications that not only improve blood sugar control, but can also support better metabolic health. If your cholesterol levels are high, cholesterol-lowering treatment may be recommended to reduce the strain on both your heart and your liver. Likewise, if you have high blood pressure, keeping it under good control is another important step in protecting your long-term health. This is why I always encourage my patients to look at the complete picture rather than focusing on one test result. Your liver health is closely connected to your blood sugar, cholesterol, blood pressure, body weight, and waist size. Treating all of these together gives your liver the best chance to recover. Another mistake I see far too often is people buying products advertised as liver detox, liver cleanse, or miracle liver repair. These products are widely promoted online, but many of them have little or no reliable scientific evidence to support the claims they make. Some herbal or dietary supplements may even place additional stress on the liver or interact with medications you are already taking. Remember, your liver already has its own natural detoxification system. It does not need expensive drinks, powders, or capsules promising overnight results. What it truly needs is a healthy environment, balanced nutrition, regular physical activity, good blood sugar control, enough sleep, and appropriate medical care when necessary. If you are considering any supplement, always discuss it with your doctor first. That simple conversation may help you avoid wasting money or, more importantly, prevent unnecessary harm. The encouraging news is that many people with grade 2 fatty liver and even many with grade 3 disease can make significant improvements when they combine healthy lifestyle changes with appropriate medical treatment whenever it is needed. There is no single magic pill, but there is a clear path forward. In the final part of this video, I want to leave you with the one message I hope you will remember long after this video ends. It is the lesson that has helped many of my patients take control of their liver health and regain confidence in their future. Before we finish, I want to leave you with one final message that I hope you will remember long after this video ends. A diagnosis of grade 2 or grade 3 fatty liver is not the end of your story. It is a warning, but it is also an opportunity. Your liver is asking for help while there is still time to make a difference. The choices you make over the next few months can have a much greater impact than the diagnosis itself. Today, we have covered some of the most important facts about fatty liver disease. We talked about what the grading on your ultrasound really means and why it should not automatically be confused with permanent liver damage. We discussed how many people with grade 2 fatty liver and even some people with grade 3 disease can make significant improvements when they begin treatment early and remain consistent with healthy habits. We also looked at the 5 common mistakes that often prevent recovery and the practical steps that give your liver the best chance to heal. If there is one lesson I want you to remember, it is this. Consistency is far more powerful than perfection. You do not have to transform your life overnight. You do not have to follow extreme diets or search for miracle cures. Instead, focus on small decisions that you can repeat every day. Choose balanced meals instead of highly processed foods. Walk a little farther than you did yesterday. Stay physically active in ways that suit your age and fitness level. Keep your diabetes, blood pressure, and cholesterol under good control. Get enough restful sleep. These simple actions may not seem dramatic from one day to the next, but over months and years, they can make a remarkable difference to your liver and to your overall health. I also encourage you to keep in regular contact with your healthcare provider. Follow the advice that is right for your individual medical condition. Have your liver function tests checked when recommended. Monitor your blood sugar if you have diabetes or prediabetes, and attend your follow-up appointments. These regular checkups allow your doctor to see how your liver is responding and whether any additional treatment is needed. Early action almost always provides more options than waiting until symptoms become severe. For those of you watching who are over the age of 60, I want to offer one more word of encouragement. It is never too late to improve your health. I've seen many older adults make meaningful progress after changing habits they had followed for decades. They lost excess weight gradually, became more active, improved their blood sugar control, and watched their liver health improve over time. Their success did not come from one perfect week. It came from making good choices again and again. Remember, your goal is not simply to reduce fat in your liver. Your goal is to protect your energy, maintain your independence, lower your risk of future health problems, and enjoy a better quality of life with the people you love. Every positive step you take today is an investment in the years ahead. If you found this video helpful, please give it a like so that more people can discover this important information. And if you know a family member or a friend who has been told they have fatty liver disease, please share this video with them. It could give them the knowledge and confidence they need to take action before more serious liver damage develops. Thank you for spending your time with me today. I truly appreciate your trust. Take good care of yourself. Keep making healthy choices one day at a time. And I look forward to seeing you in the next video.